He's pretty much that. Like, it's just a training. I just want to say that Nano is the best. That's right. So yeah, I was just looking. I was like,
I pushed it. Like, I was very like.
Light amplification by stimulated emission. Light amplification by stimulated emission. Light
I felt like I was like this.
There's a whole lot like rules on what you can
I actually was dreaming of my test. I was dreaming of my test. I was studying. It was the pool day, long day. Basically, you put on sunscreen like through Riverside Scuba Walker.
All right, gang, let's take a seat. And if you would close your laptops. I have a story. You may have already heard this story, but I know a lot of you are feeling really overwhelmed. We're getting close to the end of the quarter, final exams, all of that stuff. So I want to give you the idea to shake it off and move forward. One day, a farmer's donkey fell in a well. The animal cried piteously for hours as the farmer tried to figure out what to do. Finally, he decided the animal was old and just needed to be covered up anyways. It just wasn't worth it to retrieve the donkey. He invited all his neighbors to come over and help him. They all grabbed a shovel and began to shovel dirt into the well. At first, the donkey realized what was happening and cried horribly. And then, to everyone's amazement, he quieted down. A few shovel loads later, the farmer finally looked down the well, and he was astonished at what he saw. With each shovel of dirt that hit his back, the donkey was doing something amazing. He would shake it off and take a step up. As the farmer's animals continued to shovel dirt on top of the animal, he would shake it off and take a step up. And pretty soon everyone was amazed as the donkey stepped over the edge of the well and happily trotted off. Life is going to shovel you dirt, all kinds of dirt. The trick to getting out of the well is to shake it off and take a step up. Each of our troubles is a stepping stone. We can get out of the deepest wells just by not stopping, never giving up. Shake it off and take a step up. So as you come to the end of your quarter and you're discouraged, haven't been doing well in some courses or not getting your competencies or feeling stressed out, shake it off and take a step up because you're going to make it. You guys are all going to make it. Anyways, prayer requests we can entertain. Morning. What's that? Oropath? Feeling stressed out about it? Yes, I know. Shake it off. Take a step up.
Test today.
Test today?
Test is today for sectional.
Sectional. Okay, I was like, you just had your midterm last week.
For my brother for his recovery after ACL surgery. It's been
Okay.
a little tough for a few first days, but it's
I
getting
get it.
better.
I get it. I've had 4 knee surgeries if you haven't known, so we'll do that. Anyone else? Yes,
Is
Sasha.
God answering our prayers?
Oh,
I mean, maybe that's not a prayer request, but just in general for everyone.
inside?
Yeah.
Yep, all right.
My friends just got married yesterday, and they're about to head off to Thailand for their honeymoon.
Oh, that's on my bucket list. Okay. All righty, thank you. Let's bow our heads this morning. Dear God, thank you so much for this class. They are working so hard to be the best dental hygienists they can be. And right now they're feeling a lot of stress about oral pathology and clinic and everything else. I pray that you would each one of them still their hearts and let them know that you are right there. That all they need to do is shake it off and step up because you're right there with them. Pray that you'll be with them as they take their sectional exam. Thank you so much. That they have this opportunity to learn about different lesions so that they can recognize them in the mouth and be able to save somebody's life someday. I pray that you would be with Maddie's brother who's healing from surgery. I know what that's like and it's not so fun sometimes, but I pray that you'll bring full recovery to him. And Father, there's others that are celebrating joys of marriage and travel, and I pray that you be traveling. And in general, you answer our prayers, you hear us. It might not be a yes, it might not be a no, it might be a wait. But I pray that you would help still our hearts, help us to know that you're right there with us. And now as we have our class time, I pray that you be with the students. I pray this will be a fun learning experience for them today. We pray in your name. Okay, so your quiz, we'll do that first. And the password is did one SRP work? Question mark. Oh, you know what? And that work right there is small letter. And when you're finished with your quiz, I have a question or a couple of questions I want you to answer, so I'm going to put that up on the screen. You do not have to put your name on this if you don't want to. If you want to write comments, that's fine. If you're finished, close your laptop so I know who's finished. You can hit submit.
I did, but I need to upload. Like we upload.
It'll still upload.
It should still upload. I'm hoping it will upload.
Try that now.
I'm trying to use this as a way to hear you. What you think needs to be modified or changed. I want to try to make things better for you. If I can do that, I'm happy to do that. So this is kind of your sounding board. If everything was okay, then everything's okay. You don't have to write something. The first time. Alrighty, if you're finished, kind of move it down this way. If you're not, just finish it up. Is there anyone's paper I don't have? So I want to first go over the quiz. Oh, maybe I can't do this.
Verbally.
No, I am. I just need to see it. I don't have it right here. Okay. Okay, the first question. First of all, is anyone missing? Nope. Okay. What is this doing?
Arrested? That's what I thought.
It's making me re-log in, sorry. I had it all ready to go here.
Okay.
Alrighty, question number 1. One side effect of SRP may be excessive bleeding. True or false? Your patient can use a damp coffee filter placed on the site to help absorb the excess bleeding.
Teabag.
What is it? Good. Okay, number 2. Which local delivery antimicrobial has both a statistically significant and a clinically significant result in pockets greater than 5 millimeters with SRP versus SRP alone? Arrestin. That's what will be one of your competencies, will be placing Arrestin. And the last one, when doing a periodontal reevaluation, you should do which of the following?
Except floss and polish.
All of the above. So this is what you're doing. When you're doing your SRP, you don't polish and floss because the tissue's all raw and red and whatever else. You don't polish at that time. You do all your SRPs, you get them done. 4 to 6 weeks later, you do your reevaluation, and then you polish and floss.
Okay.
Okay?
Makes sense.
All right. Say that again? Was it a good quiz? Because you got coup de grace. Okay, guys, wait. We got a question here.
I know excessive bleeding can obviously happen, but because in the PowerPoint you underlined slightly, I was like, no, maybe she was just talking like normal effects after. But I know excessive bleeding can happen.
So what's the best answer? Can it happen?
Yeah, it can happen, but
Okay.
because, I don't know, I thought you were talking like normal after.
That's exactly how they're going to ask things on the national board, and they're going to make you overthink it. Just say, is it excessive bleeding normal? Could, yes. So that's exactly how they would ask you, and you're going to go, So just critically thinking, read it at face value. Is that normal? Can be. Alrighty, let's try this. So I thought we would do something a little fun today. Oh, this thing is not going to work. So we're going to talk about cultural diversity in dental healthcare. The stuff in this slide, I want you to not sit there and think, oh, I have to memorize all these numbers and all these statistics. You don't. It's kind of a fun thing to just let yourself absorb the information. The PowerPoint is posted, so just kind of go through it with me and run through it. Pick up what you can and apply it to your clinical experience. You'll have more things about culture coming up. This is just our introduction. Oh. So here's some historic events that has affected us. In the 60s, there was political assassinations, there's civil rights movements. There was a lot of integration between blacks and non. Back then, that's what we called them, black. Okay? I grew up in an area that had either you were a black or you were not a black. And we had what we called integration. When we lined up for elementary school, our teachers would say, integrate. And we'd have to have a white, a black, an Asian, a black, and what in between. That's how I grew up in South Central LA. And so there was a lot of stuff going on with a mixture of stuff like that. And that's what I experienced. In the 70s, there was a lot with the Vietnam War. Lots of refugees coming in. We had a lot of the Asian cultures coming in. When I grew up, there weren't that many Asians in the area. I probably had 2 in my whole class of 6th graders, and there were 3 classes of 30 6th graders, and there were 2 of us in 90. So it was really rare and unusual. At that time, I moved to Hacienda Heights to a new school. there are two of us. Odd, very odd. Now if you think back and you go to that area now, Hacienda Heights, what is it? It's all Asian. Why are they all there? I don't know. But that's what I grew up with. In the 80s and 90s and early 2000s, there was a lot with immigration from Mexico, Central and South America, and Eastern Europe arriving to the States. And then in the 2000s, now we're talking about religious liberty, Black Lives Matter, illegal border crossings. That's what the culture, the melting pot of the U.S. has become. I wish my thing worked. All of the individuals have all their traditional healthcare beliefs when they came here. So we have had, bless you, a melting pot of practices. And this also affects how people see dentistry as well. When there's a conflict between you as the clinician and that patient's belief system, oftentimes the clinician tends to minimize somebody's beliefs. Oh, well, that's not right. You will see that on your national board about minimizing a patient's beliefs or what they think. So I've seen that question on a national board question. Often the clinician knows too little about a patient's self-perception or beliefs regarding their healthcare issues and their illnesses. Since this negatively affects the course of treatment, the issue of cultural diversity and its beliefs is crucial to treatment. That's why I'm kind of just introducing you to this melting pot of beliefs. So what is cultural competency? It begins with understanding your own beliefs, your own culture, your own biases. We have multi-cultures in this room, and every single one of you have some different beliefs, something that you and your family grew up thinking about healthcare. You need to become sensitive to the cultures of others and appreciating it. And so we're going to talk about some of the beliefs that your families believed or practiced as you were growing up. It is a journey about learning and understanding other people's cultures, and it's not just a destination that you're getting to. It's ongoing, it's changing. If you look from when I began as a young child and gone through that, I've experienced a lot of different changes in the culture and what has happened with the United States and with people coming here from other countries and sharing their beliefs. So culturally competent care is really about patient-centered care. And we talk a lot about that at Loma Linda, whole patient care, patient-centered care. And so hopefully we'll be culturally competent as well. So unless you end up working in a dental practice that has primarily your culture in there, you would do well to read some books about different culture, different beliefs. And so a lot of my lecture today is coming from this book by Rachel Spector. It's Cultural Diversity in Healthcare and Illness. It's just one of the resources that are out there. And there are people that work in primarily a particular culture. For example, you're working in particularly a Hispanic culture, you're using your Spanish language, or you're working in a particular Asian culture and then you're using your language as well. So unless you're doing that, it's good to figure out different cultures. So let's think about different biological things about different people. So there's different body builds and structures. You all know this by taking FMXs on different patients. You've seen people with big old mouths and you're like, yes. And then you get somebody with this tiny little mouth and it's really hard to take x-rays or even to see. So different builds and structures. You've got skin color and different textures and tones. So if you look in the mouth, some people you see a lot of melanin, the melanin. So you have some different coloring in the gingiva. You can see the different healing abilities. Certain cultures we know heal better than others, and other cultures develop other things like a lot of scar tissue or a lot of keloids or other things like that. So when we work on them, we need to figure out, okay, who's going to heal up really well, who's going to have a little more trouble. There's also genetic variations or enzymatic. How do you process or respond to a drug or dietary therapies? So let's take, for example, you've all given anesthesia to one another. There are certain patients that no matter how slow you're giving that anesthetic, it burns. It feels like you're just burning them. Does anybody experience that when they're getting their anesthetic? So some of you do. It's because of the type, what the pH is in there and what's going on when you're injecting that. It's not that the person is giving it too fast or whatever. It's because your body is responding to that drug differently. There's also the susceptibility to disease, and there's higher mortality rates in certain cultures, certain backgrounds. And there's also nutritional variations. Some people eat more of one thing or other and don't eat more of another. There's also communication differences. For example, language differences. Okay, this is probably the number one obstacle in healthcare is language. That's your barrier. Not only is it beliefs, but if you can't communicate, it's difficult. There's also verbal and nonverbal behaviors. Often it's frustrating. When I was a missionary in Guam, I worked there for 8 years as a dental hygienist. It was the first RDH on the island. How many of you have a Filipino background? Okay, so a couple of you. When I started talking to my patients and I would ask them a question, they would go, Well, that meant yes. Correct? Yes? And I was like, they're saying but they're nodding their head, Okay, different cultures, different language have different backgrounds. And their behavior, non-verbal behavior, can mean something else. Sometimes giggling means discomfort. Or sometimes when they don't say anything, it means they agree. Like if I, in our culture here in America, in general, if we don't say much, we mostly agree?
No.
No, not always. Some people, when they giggle, it means they feel uncomfortable, or they're embarrassed, or they're nervous. So silence, we're talking about silence. Language differences possibly the most obstacle in providing multicultural health care. Personal space. There is an intimate zone, and that extends about 1.5 feet. And it's only acceptable in private places. So, for example, to make you uncomfortable, AJ, because you're standing right here. Okay? So, if I start to talk and I get in AJ's face and I'm talking like this, do you feel comfortable or uncomfortable? Uncomfortable. We're used to that intimate zone only for private situations or private places. So, you are working in somebody's uncomfortable zone. Do you get that? I've had numbers of patients don't want to open their mouth. They'll sit there and go like this. I say, could you open? And they're like, I don't want you to look in my mouth. And I'm like, well, when you're sitting in my chair, what do you want me to do? But they're uncomfortable. There's now a personal space that extends from 1.5 feet to about here to 4 feet. Okay. And then there's the social space. Now, if I'm talking to you here, we're good, right? Feel comfortable, reserved for impersonal business transactions, whatever else. And then there's public space, 12 feet. So there's generalizations about personal space depending on where you're from. It varies among ethnic groups, and there's extreme modesty of some cultural groups. So one year we had a particularly large group of Middle Easterners in as far as students go, big group of them. For some reason there was a lot. They had a really hard time sitting around a patient like this. They always wanted to sit like this. that make sense for these Middle Easterns? They had a really uncomfortable time learning that you have to sit like this. 'Cause that's just culture for them. So, personal space. Asian culture. Do they like personal space? Or they have personal space? Okay, so visiting China, visiting different places, there's people everywhere. And I would like walk down the street, and for me, the first thing was I always smile. You cannot smile at all these people. So you learn to just walk and do your thing. And there were so many people bumping you, especially on a bus or a train. I remember holding my purse and going, who's touching me? Like, get out of my bag, because I don't know who's pickpocketing me, what? I'm feeling really uncomfortable, or getting in there and not being afraid. Sometimes you have to push to get where you need to be. That wasn't really comfortable for me. It's still not always comfortable. But now I've learned, because I've been to China a number of times, working there and whatnot, that sometimes I just have to push to get where I need to be, because they're standing there and they don't mind. They just know they have to move out of the way, how to get through. Culture. So, yes.
Isn't Asian culture not a very big term? Like, is that such a big term? Like, Asian culture? There's so many Asian cultures. Like,
Correct. I'm using it broadly.
Okay.
So I'm using it in as far as the East, like Pakistan, India, that's still considered Asian. Versus China, Japan, Korea, still Asian. Okay? So in the 2010 ethnic cultures census, they looked at these different groups. White are considered Europeans, Middle Easterns, North African. Black or African American, American Indian, and Native, Alaskan Native. Asian, that's Far East, Southeast, Indian, subcontinent, China, and the Indian Philippines. Then there's a Native Hawaiian or Pacific Islander, such as Guam and Samoa, or a Latino or Hispanic. That could be anywhere from Mexico, Puerto Rico, Cuba, or Spain. It's considered a Hispanic or Latino. So if we're looking at the population in 2010, this is what we came up with. 0.9% of the U.S. population is considered American Indian or Eskimo Aleut. Asians were making up 3.6%. The black population was making about 12.6. Sorry, it was 4.8 in 2010 for Asians. Hispanics were 16.8, and the white population was only 63.2% in 2010. They do these censuses about every 10 years, so we're due in 2020 to have a new census and figure out what our population is like. Now, if we look at immigration and legal permanent residence by country of birth from 2015, 15% of our population was from Mexico, 7% from China, India, and so forth, just to kind of give you an idea of what we have as a melting pot here. So what is health? If I asked you what your definition of health is, what would you say?
Living up to your well-being.
Well-being, living up to your capacity. Without disease. Okay. The World Health Organization is the state of complete physical, mental, and social well-being, and not merely just the absence of disease. So that's the combination of what you said, it was all of it. So Mosby's dictionary said it's a high level of wellness or homeostasis. Okay, we're status quo. Many healthcare workers say it's the absence of disease. What is your definition of health now? So you've heard about this healthy people. This Surgeon General has come up with all these reports. Healthy people this, healthy people that. Healthy People 2020 is coming up. But in these reports, they've wanted to, in 2010, to increase the quality and years of life and eliminate health disparities. What do they mean by eliminating health disparities?
Access to care.
Access to care, AJ says. So they want to be able to get everybody as much access to care as equally as they can and still increase the years of life. Good. So in 2020, Healthy People 2020, they want to attain high quality, longer lives. They want to achieve health equity, promote good health for all, promote quality of life, healthy development, and healthy behaviors. So they wanted to establish benchmarks and progress. How are they going to do that? They're going to encourage collaborations between different groups, guiding individuals to making informed health decisions, measuring the impact and addressing questions. What makes some people healthy and others unhealthy? Okay, you see these people. Smoking, good for you, bad for you? Bad, we think, in general. Well, why is this guy still 80 years old smoking like a whatever, and somebody who's 30 gets cancer? Why? Somebody who's never smoked a day in their life, but they get lung cancer. Why? And so we're just trying to create a society where everyone has a chance to live long and healthy lives. How do we do that? Is exploring the preceding questions by developing objectives to address the relationships of all of these things. So what do you think will be the likely trends of our patient health trends for our patients at LLUSD?
Dentures.
So he's saying dentures. Are we moving towards dentures or away from dentures? Away. What are we moving towards? Implants. Okay. Is implants feasible for everyone? No. Why? It's expensive. So you have to go to the second best, a denture. Okay. What else are you seeing as healthcare trends at LLUSD? I'm sorry? Just here. Like with the patients you've seen so far. Restorations? What kind of restorations?
Composite.
Crowns, bridges. Okay. What are we moving towards? Towards composites or away from composites? More towards composites. Okay. When I learned how to do that, we were putting in more amalgams than we were composites. But they're getting better materials. But the reason why amalgam generally lasts longer, composites don't last as long, so they get to replace. At first it was more about, they just want to replace all your fillings so that they can get composites in there because composites don't last as long. And so it was a money-making thing. Let's take it all out and put all this in. But now composites are stronger, they're better, we're learning more about them. And so they're lasting longer. I still don't think they last as long as amalgam, but there's still other people who are like, no metal in my mouth, I'm gonna have composites. So we're different health trends. So here are a couple of things that are barriers to healthcare. Talked about access, age, education, gender, geography, homelessness, insurance. My insurance doesn't cover it, so I don't want to do it. Language, philosophy, race, religion, economic, socioeconomic status, technology, transportation. So all of these things are barriers to healthcare. Healthcare providers are socialized into the culture of their profession. Listen to that. Healthcare providers are socialized into the culture of their profession. The professional socialization teaches the student a set of beliefs, practices, likes, dislikes, norms, and rituals. So we are teaching you your own culture as dental professionals. Now, how is that affecting you? As a professional healthcare, students become more knowledgeable. They usually move further from their past beliefs and further from the general population in terms of understanding beliefs and regarding health issues. So have any of you changed any of your behaviors from when you walked in the door to now, or any of you changed any of your beliefs about something that you didn't know but now you know and thought, oh, well, I've been doing this wrong my whole life? Give me an example.
Your toothbrush softness.
Toothbrush softness. Sandra, same thing?
I used to brush my teeth with charcoal at least once a week.
And how about now?
Oh, not anymore.
Okay. That's interesting. Anyone else?
Growing up, my mom always said Florida was bad. And now,
Is your belief changed?
definitely.
Okay. So we have our own culture as dental professionals, so we're moving further away from what our own norms and beliefs were as we were growing up. And we'll talk more about that in our discussions later on. But it's changing. The more educated you are, the further away you are from your own system of beliefs that you had when you walked in and the general population. I've heard this numerous times. The doctor comes in, or maybe you've had a consult with a path consult or a periodontist, and the patients go, I have no idea what he just said. They're speaking a foreign language. Have you had that experience yet? Where you have a consult over and the patient goes, what they say, what does that mean? So you're going to have to translate all of that. In light of this, healthcare providers can be viewed as a foreign culture or an ethnic group. They have a social and cultural system. They experience ethnicity in the way they perceive themselves in relation to the healthcare consumer. So you are no longer part of the general population. You are your own ethnicity as a dental professional, and you're growing and you're changing the more you learn. So here are some the multi-step process in culture diversity, and that's just helping you explore different cultures, understanding complexity, awareness of socialization process, and then developing the ability to hear what your patient is saying, really. Not just the words they're speaking, but what are they saying from inside their heart. So the current healthcare problem by ethnicity, I'm going to break it down for you really quickly. The American Indian Alaska Natives, they experience really low health status compared to other Americans. Their life expectancy is lower. They have more burden for disease. Their infant mortality rate is 10 for every 1,000, compared to the U.S., 7 to every 1,000. Alaskan Natives and American Indians tend to have a high alcohol abuse. It's the most widespread and severe problem in the American Indian population. And this is costly to the people. There's many underlying problems that occur with alcohol abuse, and the problem is still getting worse. Ten leading causes of death among the American Indians: unintentional injuries, chronic liver and cirrhosis, diabetes, suicide, homicide. Asian Pacific Islanders say they represent 4.8% of the population. It's the third largest emerging majority group. It's grown from 43.3% in 2000 to 10.2 million to 14.6 million. So it's growing. Half of the people claim Asian as their ethnicity in just 3 states: Hawaii, California, and Washington. Can you see how that could be true? Any of you been to Hawaii? How many have been to Hawaii? A good majority of them. Majority of the population, Asian. Cities with the largest Asian populations, New York, Los Angeles, San Jose, San Francisco, and Honolulu. So, the Asian culture, look at some of their remedies. Acupuncture. How many of you tried acupuncture? One. Work?
Yeah.
It did work? Ooh, sorry.
I like it.
Okay. If it's not too invasive, can you tell me what you used it for?
For attention headaches and
Headaches?
during my
Okay.
days. It was literally like that first one.
Did it hurt?
You barely feel it.
Okay. Herbal remedies. Asian cultures like to use a lot of herbal remedies before they will seek out health care from a professional. In most of the selected categories related, the Asian population rates are lower than those of the general population. They are a lower rate of births to teenagers. And I'll tell you why, because we're all scared to death of our mothers. Lower infant mortality, lower incidence of cancer, lower incidence of homicide and suicide. But there's a particular group in Guam, remember where I worked for 8 years? That has the highest percentage of diabetes in the world. Almost everybody that sat in my chair was a diabetic. It's crazy. They've been studying this group because of what's been going on here. African American, blacks, grew at a slower rate than most other major races and ethnic groups according to 2010 census. Many experience wide health disparities due to the past lack of access to health care, due to low income, and the tendency to treat the illness and wait until symptoms are so severe that they have to go see the doctor. And the big problem here is adolescent pregnancy is a major concern with this population. So here's some issues for blacks. Have you studied this in MedCom? Sickle cell anemia? Okay. Predominantly affects this race. The blacks born in 2000 in the U.S. will live on average 5.7 years fewer than whites. The chronic leading diseases for them are the same: cancer, health disease, cerebral vascular disease, but the rates are greater in other diseases. So there's a number of them that are living with end-stage renal disease, coronary heart disease. Homicide is the most frequent cause of death for them, for the males aged 25 to 34. Higher incidence of prostate cancer, and HIV is more prevalent. Hispanic population. More than half of the growth of the U.S. in total has come from the Hispanic population between 2000 and 2010. The terms Hispanic and Latino are used interchangeably in the census in 2010. 3/4 of the Hispanic population comes from Mexico, Puerto Rico, or Cuba. So anyone in here from any of those three places? Raise your hand. Raise your hand. There's Mexico, Mexico, Mexico. Okay, good. 41% live in the West, and 36% live in the South.
Is that referring to like the Southeast or just South?
I'm just saying in the South. That could be Texas. That could be any of those states, okay? That's what the book said. So Hispanic issues, they are marked by diversity and experience that are varied set of health issues. They encountered by the emerging majority population. So the greatest barrier to health care, language. Language, language, language. The final barrier for many Hispanics is time orientation, okay? Everybody's taking a siesta, right? No? But time, they don't have the same regard for time. You will notice your Hispanic population, they're going to come late to the appointment. Not all, I'm making a generalization, but they're irregard of time. They arrive late or do not keep their appointments, and they prefer to go to walk-in clinics and they can go when they want to go. True? True. Okay. So here's some issues with health for them. The first 3 chronic diseases are the same for Hispanics and whites. But Hispanics tend to have a lower rate of Alzheimer's. But they have a higher rate of homicide. It's the 8th leading cause of death for them. Higher percent of death due to chronic liver disease and cirrhosis. Why? They tend to drink a little bit more, right? Cerveza. Tequila. Okay, the white population, 64% of the population is white, with a total of 72% if included those reporting they were white with a combination of other races. For example, on mine, I claim a white population because my mother is Hawaiian, Caucasian, and Asian. So I claim all 3 of those: Pacific Islander, white, and Asian. The white population increased at a slower rate than the total population. The majority of whites immigrated from the European nations and largely happened between 1820 and 1990. So that's exactly what happened to me. A whaler from Europe ended up in Hawaii, marrying my Hawaiian great-great-great-grandmother or whatever. And then they married Asian, and that's how I got all this Asian. And then my dad happened to be Asian. But my mom is white and Hawaiian. Health issues for whites. The major is they mirror the major health issues for all populations combined, with the exception of suicide being the 10th leading cause of death versus septicemia for other populations. Suicide. Why do you think that's so?
Seasonal affective disorder.
I think so. He said seasonal affective disorder. Are we all stressed out here?
Maybe like an overwhelming access to care, so the medications, drugs.
Could be all of that. I mean, I have no idea. I'm just throwing it out there. They have lower rates for all cancers combined, but they have a slightly higher rate for breast cancer, prostate cancer, and lung cancer. Lucille.
I think it has something to do with the individualistic society.
Rather than grouping together.
Yeah.
That's very possible. This is what I've experienced. The Hispanics, when they get together, they're very family-oriented. Okay, right? You gotta have a fiesta for everything. Right? In Guam, we had fiestas all the time. Guam has a very Spanish influence on it. They were ruled by Spain for a number of years, so every weekend was fiesta. Oh, hey, they're having fiesta down in Sinaraha, so let's go down here. Oh, and Talafofo, they're having their fiesta, so we go down there. It's grouping, partying, okay? Asian, same thing. They're very culturally united for the most part. I would say the same for black, true, but maybe the individual, so that's an idea as well.
White. Don't do anything.
No, I'm not saying they do, because they do, but I don't see that as much. I don't see that as much. Doesn't mean they're not doing it. That absolutely not. So, what we're going to do is we're going to take a break, and then we're going to get in groups, and we're going to work on a project. I got some questions for you. So, it's, let's go by that clock back there. If you could be back here by 8 after, that gives you 10 minutes.
Okay, so these
have a comment. So, for this presentation, I just felt like the blacks, I just felt like every bullet point was.
I just took it straight from the book.
And then also,
Don't mean that, honey. I can from the hood too, so that's where I grew up.
well, because the other thing was for the Hispanics, for white, probably come from different places, but for blacks, it was just like, because you know, for me, I don't consider myself African American.
Correct, I agree.
So it was just like, there wasn't any, I just feel like
Break
it
it
was
down
a whole
more?
different tone. It was just so boring. It was, they have this, they have this, they have this, they have this, and then like white was like,
Okay.
we don't have this.
Make a modification. So help me, not intentional,
Yeah.
just took it straight from the book. Tell me how I can break that down.
I think maybe talking about, because there's
Okay, so let me say, there's African, there's Caribbean,
yeah, and from the Caribbean, there's so many different countries, you know, there's Jamaicans, Haitians, and so they kind of group us all into the same category. Just like with Hispanics, how there's Mexican, there's Puerto Rican.
yeah, there is.
You know?
Okay, so the book didn't break it down like that, so I just took it straight from it. So let me do, so African Americans, so they're from Africa, Jamaican, Haitian, there's all of those ones, the Caribbean.
Yeah.
What other place would you want me to do? Or just separate the
say
two?
that there's, you know, like, because I know for whites, they're all over the place, you know, they're from all different countries. Just to say that.
No, I'm happy to do that.
Yeah,
No
because
problem.
I really like the
No,
show.
I'm trying to do that. You know that. You know me better than
Just
that.
covering each other, like, it was just so like, I was like, what? Comments, it's so easy, yeah, this and this, this and this, this and this, and it was just like not one good thing.
What good thing would you
Whereas
want me
the
to say
tone
besides
changed
this?
when we got into like,
Okay. What?
I mean, I'm
Taking this
Yeah.
will help
Yeah.
say that not all are the same.
yeah.
Some are from the Caribbean, which is totally different than what's coming from Africa.
Yeah.
What else?
I can look into it.
Well, and I can look too, but I'm just saying, if off the top of your head, can you think of something?
In terms of scientific base, no, I
Okay.
can really talk from like my own experience.
Okay.
Yeah, I don't have the
So
statistics
Jamaica,
to back
Haitian,
it up.
there's all the little Caribbean islands. They're all different.
Yeah.
Okay. No, I'm happy to do that. That I wasn't intentional by any means, and you should know me by that right
Yeah.
now. I'm like,
Yeah.
okay, that's where I grew up.
Yeah.
My best friends.
Where?
South Central LA.
Oh, yeah. So lots of guys there.
Yeah,
Yeah.
when they were doing the integration thing,
Yeah.
I was there. I was right there. And then I moved to a place that had very few no Asians, and everybody was white. It was 290 in 6th grade.
Yeah.
So that was weird for me. I don't think we had one black. I can remember.
Yeah.
Because it was a very affluent area. There's two, like the end, you know, the 60 freeway, it's right out there.
Yeah.
60 freeway ended in where I moved. It never came out here. Never. People from LA were like, why are you moving there? There's nothing but cows out there. It's all dairy.
Yeah.
So
That's what it was like around here?
where I was, the freeway ended there, and it's 30 minutes that way. The 60 freeway ended right after where I moved. So people, when we moved there, they're like, why are you moving out there? It's just a bunch of cows out there. And now look at the 60 freeway goes all the way out to
Yeah.
So, no, that's how I grew up. So, and I feel like I have a really good multicultural background because of how I grew up. I grew up with Asians, and I grew up with a lot of whites. And I came to Illinois, and we have so much multicultural here, which is so cool. So I'm cool with that. My husband grew up and went to Linwood Academy. I don't know if you've ever heard of it. It's probably not Linwood. It ended up being, back in the day, it was a white academy. And it ended up being majority black. And so he used to sing in Soul Church. And he's a really good singer, so he just loved it. And then sang in a group called A Simple Gift. He was well, originally he was the only Asian guy. He's half white, half Asian. And all black group singing because he just loves that kind of music. That's where he grew up. I grew up on that, so we loved it. So I'm definitely not.
Yeah, I had a feeling that.
No, I just took that book and went through it. To give you some highlights instead of reading this thick book. I was trying to get you bored. Yeah, no, I can split it out into one more.
We need to ask Sabine.
I want to say as far as healthcare goes,
Those
disparities are
for sure.
I don't know that they're any healthier than
It was more, I think it was the vibe when you transition to other, it was just like when you got to Hispanics, it was like, and you were talking about how they don't have Alzheimer's and this and that.
Okay, no, I think this might help bridge that by saying they're different. They're all like here too. It's like Asians are different because Indians are totally different, but yet they share in the groupness together. So no, I definitely can split that up. No problem. All right, thank you. I appreciate it. Alrighty, I want you to assemble in a group of 4 diverse individuals. I'm going to actually make it 5. I'm going to make it 5. Your class is a little bit bigger than last year. So what I'm going to do is get into group of 5. So I don't want 5 Hispanics in one group. Okay? I want you to mix it up if you can. But here's the deal. Listen up. So if you're from Colombia or Venezuela or you're from Puerto Rico, you can mix. But I want some whites and some Asians and some black if we can to get into different groups. So, that's okay, girl. All right, so get in your groups of 5. I'm going to say 5.
Christian, you want me to do that?
I want somebody to be the scribe, write notes for this, because we're going to share it in class.
Why? You're a man. She's going to be the scribe. She's back. Hey, no, but I'm actually like, Sarah and I are.
Follow my toes, yep. Wait, we need one more person. Preferably not white. Not white.
We'll take one.
Brian, where are you? Come on. He's an Asian. Yeah, we need an Asian. Yeah, we need an Asian. You're for whatever. Okay, you're done.
We have like one.
They can only have one in that group.
Oh, you're with them. Say hi. It's human.
I guess.
Who's in your group?
Yeah, keep the minority.
I know, but now this is Irish and German.
Thank you. She's putting on the white hat, the half white hat.
Oh, I didn't hear it, sorry.
You ever heard me talk and her talk? Oh, gangster. She's from Washington. She's white. You're doing typer, right?
Yes, just one person in your group. You can type if you want to.
Alright, well, let's start with Simi.
Okay, so we have Emily, Grace, Catalina,
If you guys want to type your answers, you can do that. I'm not going to collect it. I'm just going to ask you to give a report. So if you want to type fast, type it. All right, your family values.
you got me falling, you're pretty high. I know you're watching it.
Yeah, maybe because more home memories. I feel like whites are more, go to the doctor, and I feel like other ethnicities are Japanese, and they make more complicated.
South Americans, white go to the doctor and the rest of us.
Kind of. I mean, you're because I mean, like a lot of cultures resort to no, I mean they have like let's try something at home first. Like I kind of grew up with that a little bit. Like a certain extent. I go to the doctor on a regular basis, so I can't say that mine goes 4 out of 4. Wait, are you? I just say that. Are you? Yeah, like after you try.
It didn't go away.
Yeah, like it's like it's in your blood. Yeah, but I don't think you have I'm just kidding. Oh, big, yeah. I use everything. Aloe vera, I use like that was my home remedy. Like yeah, but it was like get a sunburn. A lot of those. So why you went? So your Uncle John, that's the said Uncle John and Uncle Ian? Oh, like the two brothers, like one brother has a friend that's like, oh, so I think we all named that Uncle John. Oh, I did it in various. Right? Huh? No? So like, oh wait, I feel like as a kid, like your parents, like I mean, at least here, we have to get vaccinated first. We didn't really have a choice, so it's a little hard to like.
I put aloe vera, like aloe vera, like sunburn.
We had to get a You too? Yeah, so you had to get all of that.
That's
Oh, you were back. But your school required it and your parents so I stopped fully vaccinated. My dad was I don't want to lie about that. But I don't want to sound like I have to go get my
after a hot shower and then back your ass up in a towel. Canada tried the ginger ale. I want Canada ginger ale.
It's not favorable, right? I usually that's it's from the movie. Actually, you saw somebody post a picture of their kidney. Like my dad, it was a chicken nugget with scam, which is for like I hear pretty. And I was like, man, I still have that for you. Like, I just feel like I think if I was anyone else have an answer, like if you tell me, okay, so that's
for everything. Or you can just
jelly sandwich, the Uncrustable.
Oh yeah, but
like a Costco.
I buy the bread and I mention that's why I say it's rich though. So, but
All right, how are we coming?
frozen people.
Now, one group done? Another group done?
We're done.
Another group done?
We're done. I never eat.
Huh? How about you guys? Okay, I'll give you 2 minutes. You guys,
It's like a it's a name and I come in different forms.
Oh yeah, home running.
Like 3 of us sitting in different rooms.
Calm down.
How do you differentiate a plant from your
Like what the
Differentiate the blood. Yeah, the blood vessels is more blood vessels than you see large cells.
Like who started that trend?
There's not a bump in your nose that it's not like giant cells. Because it's only happened well, no, you won't find them on your palate. So it's only on your giant cells. What's the difference between a short They are both. So one is a benign Well, one is just one cell and one is not We're not Yeah, it's gonna be classic Liz. She's just good. I mean, I don't know about so. Yeah, but I mean, in the part, those ones are gonna be mostly like, yeah, pictures are gonna be like, okay, integrity, and
Alrighty, let's have our reports. I'm gonna start in the back. So Lucille, tell us who is in your group and tell us a little bit about your conversation.
Okay, we had Miriam, she's Mexican. We had Sarah, she's Persian. I'm Lucille, and I'm Haitian. We had Megan, and she represents the Caucasian population. And we had Paola, Mexican population. And we had Christine, and she represents the Chinese population. You talked about your family values and opinions. We just talked about how, say, sometimes the Persians, they're sometimes typically late to appointments. So that's expected. It's not too bad. Mexicans can be early sometimes. It just depends. I just mentioned about Haitians. They like to dress up to appointments. They like to look really nice when they come to like doctors, any kind of appointments. I think it kind of helps them, like, despite of their conditions, you know, like everything's okay. Caucasians relatively on time. It kind of depends on the person. We talk about like Mexicans, whites, typically casual. Home remedies. Paola was mentioning something about them putting salt between the thumb and the index finger, and like that kind of helps with digestion or. I may not be right. I just what I heard. Lime. They eat a lot of lime. That helps with a lot of things. Haitians drink a lot of like lemongrass and like teas, different teas that they drink, and it's just to cure everything. They also, I remember my parents and my grandparents would wrap if I had any swelling or any broken bone, they would wrap it with corn grits and salt, and they would like make like kind of a poultice.
Corn what?
Grits.
Corn grits.
Grits. Oh, okay.
And a lot of salt, and somehow it brought down inflammation. And it worked every time, I don't know. Chinese and Haitians drink a lot of ginger. That helps like almost everything. Chinese Vicks on like the back of your neck. And then we talked about your family seek medical help. Mexicans, whites, in our group, they said medical care first. Chinese, both. Persians, absolutely home remedies first. Haitians, typically home remedies, I think overall. They try that first. And then family concerns about, I think overall in all the cultures, just kind of like money-making schemes and like over-prescriptions. And we talked about also kind of like the manly pride, like not wanting to seek care from
The male population?
the male population. And Hispanics, like,
Okay. Let's go with this group right here.
Here?
Yes.
Yes, hello, you.
They told me to do it. Okay. Okay, I'm Korean, and then she's just Mexican there, and then Guatemala and American.
Okay, wait. Make it clear. So Mexican?
Mexican, Korean, Guatemalan, Mexican, and
My dad's half Cuban and my mom is Native European.
Oh, wow.
Interesting. Big combinations. Okay. It's just her big toe. Okay.
For me, as a Korean, like our family, yes, our parents, if I think about the healthcare, they only think about like healthcare is the best job for the Korean, like with their children. I didn't think about like going to the healthcare, but like in the top of my head, I was thinking that a lot of Asian culture, especially Korean culture, they want their children to be in healthcare, top number one, no matter what. So there's a lot of pressure for the children too. So number 3, home remedy. Actually, my dad is a pharmacist, so I don't really use the home remedy. He always prescribed for me, so I didn't go to see the doctor a lot. I just go to checkup. That's it. I didn't except dentist. I didn't have to go to see a dentist. But for the medicine, I never really go to see a doctor. With my parents and all my family. And then, I did the arbor medicine. Like my dad has a license for that, so he knows how to prescribe the arbor medication.
Herbal medications? Okay. So what about the rest of your group, Hillary? You're the spokesperson.
I'm speaking another subject. My dad is her mom is a nurse, so her mom is a nurse, so she always recommends her to go to see a doctor. Yeah, it's kind of different.
Yeah?
Yeah.
Okay.
And then she said she doesn't have a home remedy, and she just visiting doctor and get medication like that. And then for Heidi, for the
basically like male population, like or the guys won't go see a doctor at all, and it's usually like the females forcing them to go.
Tough exterior
all
of the
tough,
doctors.
yeah.
Okay.
And we do have a lot of like remedies and all that stuff, but it's like teas, and like Alka-Seltzer.
Kind of tea.
Like something that I make is like cinnamon with like honey and lemon.
Okay.
Something like
So a lot of lemons. I keep hearing
Yeah.
lemons, cinnamon, honey.
and I'm Mexican. In my family, we do value healthcare, so we do our physicals annually. We go to our dental visits every 6 months. We rather prefer home remedies rather than medications.
For my family, I feel like they go more for like doctor, but not more dentist. We do use a lot of like herbal medications.
Okay. Good. Okay. So So when you give your reports, we want a general report. I don't need to hear from 5 people because we don't have time to run it out. So let's start with this group here.
Sabine is Haitian, Nana's from the Dominican, Christian is Mexican, I'm Irish and English, and Dennis is Irish, Welsh, and German. We both pretty much agreed that in our households being raised that we sought healthcare a lot.
They can't hear you back there at all.
We all agreed that we sought home remedies just for smaller things. A lot of Vicks Vapor Rub and tea, citrus leaves, honey, ginger, lemon, aloe vera. We all sought dental care and health care as children. That was pretty standard in our homes growing up. And then the only thing, family concerns about formal medical health care, my mom was an anti-vaxxer, so I didn't get vaccinated when I was little. And then I did when I was older.
Okay.
Yeah.
Interesting.
Yeah, everybody else had pretty standard.
All right. Let's go with the group back there, Brian.
Okay, so Naveen is Middle Eastern, Brian is
From Myanmar.
Really? I didn't know that. Myanmar.
Where's
Burma.
Yeah.
What's that? Thailand, Malaysia, Burma, all in that area. Cool is that? I didn't even know that. I thought you were Korean.
Jessica is Caribbean, I'm Italian and Scottish, Aileen is Salvadorian. And then the values and importance of healthcare, almost all of us except for my family feel like healthcare is important. Like, I don't know, my family in general just doesn't really pay attention to diet and things like that. As far as remedies, Naveen was talking about cinnamon tea after giving birth. They will drink that for 40 days straight.
Cinnamon tea?
Yeah, it's like coconut and walnuts on top. We should bring some. It brings out everything inside, especially after. Brian was talking about grinding wood for makeup.
Yeah, it's called a thundercut. And so what they do is they take wood and stone and they grind it and they use it as makeup, and it's good for your skin, I guess.
And then for Aileen and Jessica, they both talked about herbal teas. So for sore throat, lemon and honey, nausea, oregano tea, diarrhea, yucca root juice, and lemon and salt. And then also onion tea for sore throat. And then Vicks Vapor Rub. And then for myself, lemon and honey tea with apple cider vinegar, and then aloe vera plant for skin burns. And then as far as seeking medical attention, all of us would do that first. Naveen said that her family would use remedies while they're waiting, and then Aileen said her family would do home remedies first, like a potato on the floor.
A potato on your forehead? What's that for?
Take headaches away.
Okay. So if you walk around with a potato, you never know what they're doing.
And then the last one was the concerns about medical treatment. So none of us except for me said we really had concerns. Mine would just be we always try to get a second opinion.
Mm-hmm. Okay. Alrighty, this group here.
So it's a story here. So Tiffany, she's Vietnamese. Kayla is Hispanic with German, Irish, and 2% Congo. Sunshine is British and Northern Italian, and I'm half Mexican, Peruvian, half German French.
Oh, wow.
All of our families kind of agreed that we need to wait it out before we go to the doctor. Like, we just kind of wait out if it's just a cold or something, and you only go if you really need to. Home remedies. Tiffany was talking about how they use a lot of tiger balm, but something interesting is they put tiger balm on their coin and you scratch it on your back.
Really? For what?
For colds or fevers.
they just believe that like you scratch, like you put like tiger balm on a coin and then you scratch your back and it's supposed to absorb into your body.
So the metal or
I don't
coin?
really understand.
Okay.
I just do it. Something that my mom taught me.
Okay.
We also talked about alcohol infused like tea for like colds and sore throats and whatnot.
Rubbing whiskey on the gums for the babies, teething.
Rubbing whiskey on a gum for a baby?
Or a baby.
Give them Anything else?
Also wrapping up like in a blanket to sweat out the sickness. That was very common. All of our families would do home remedies first. We would only go to the doctor unless like you don't get that.
Okay. All right.
And then family concerns was mostly that the doctors, they just want money. They don't really care about your health, or if they do care about your health, they want the most expensive option. So it was just kind of a money concern.
So now listen to that. Now when you're presenting your patient with 4 quadrants of root planing, it's going to cost them $1,000 in private practice. Can you see how they think it's just about money? But they really need the scaling and root planing. So now you're trying to say, this is what I believe, but this is, I know this remedy is going to work. I know scaling root planing is going to help this patient. How do I get them to understand that? So good point.
Yeah, just a good question about that. Isn't that also the, we know scaling and replanning isn't that like intensive, like for us to do it, why are we charging $1,000? Would be like the opposite side of that. Just speculating from, not to
Because
actually
it's
answer,
time
just to think
and
about
what you're doing.
Like it is $1,000 if that's a lot of time.
Yeah, it's usually about 200 a quadrant, 200 to 300 a quadrant, depending on how severe it is.
Yeah, but I'm saying yeah, they need it, but then the opposite side of the question is why are we charging $1,000?
Okay, I got it. Yeah, I hear it. All right, next group here.
Right here. So in our group, it's me, Christina, Jessica, Kevin, and Laura. I am white. Christina is Filipino. Jessica is Lebanese. Kevin and Laura. So for the first question, ethnic origin. Your family values and opinions on healthcare. My family kind of stood out, like we kind of generally totally trust modern medicine overall. For Christina, they don't believe in medication, but they do home remedies and generally not really dental care. For Jessica, they focus on like home remedies and herbs and foods and stuff. For Kevin and Laura, they do home remedies, and if it doesn't work, they go to the doctor. Kevin mentioned a lot of antibiotics in Mexico. Home remedies that your family used. Again, growing up, my family used like water. So like soak your feet in water if this, but like other than something really. Christina mentioned hot water and salt, like gargling. Jessica mentioned foods and that's something.
Healthy eating, like cleaning, like we would make turmeric tea a lot.
Turmeric tea.
Kevin and Laura mentioned herbal tea and other things. And as far as concerns for medical health care, time mostly for my part was like time, like how long is it going to take. For Christina, it's like last week, healthcare was just generally a last resort. For Jessica, chemicals and additives that they use and like, I guess, injections and stuff. And for Laura and Kevin, they mentioned the expense. Kevin mentioned expense.
Who's doing this one?
That would be me. Okay, hello everybody. So, so for our group, there's of course me. I prescribe to the Dutch and Italian portions of my family, so that those are the cultures I identify. We have Grace to my left, who's Indonesian. We have Emily, who's French and British. ethnicity, origin. We have Daniel, who's Colombian. We have Catalina, who is Spanish and German. We have Monina, who's Filipino and Chinese. And so like our attitudes and like our values and opinions on healthcare, a lot of us really said, except for Catalina and Emily, that we only go to the doctor when we're sick. Not so much on the physical side and just normal visitation, but we're all healthy right now. So, and as far as home remedies, Grace said the thing their family mainly does is they eat a lot of ginger and they stay away from canned foods. Monina does ginger tea. Daniel does salt water with lemon, and warm water, salt water. That's what I remember doing too. Catalina says prevention and eating healthy. Very good. And I said chicken noodle soup and 7-Up.
Yeah, my mom gave me 7-Up.
Yes. And you lay in bed. And so and Grace had said one that I never heard of, was her Tiger Balm.
Well, she did too.
Yeah.
Tiger Balm. Same thing.
And so like a majority of us would try like these home things first, and use over-the-counter meds, and like if it was longer than 2 or 3 days and you're still sick, then you go to the doctor.
Okay.
And then like family concerns, some of us, there is the healthcare as a scam approach with some of our families. But like, versus my family, it was like they really just avoid things, and we just like bury their head in the sand.
So they don't pretend it doesn't exist.
Doesn't exist.
Well, I tell you, that's the same thing that happened to my grandmother. My dad had brought his family over from China, and they were all living in our house. And my grandmother started to have some bleeding. And she told her daughter about it, but she never told us about it. She ended up dying from cervical cancer. Cervical cancer? Uterine cancer. So it was something that could have been treated, but they kept it a secret. So burying their head in the sand, I get it. Yep. Okay, last but not least, I think.
Yes. Okay, so we generally have half Hispanic, half white people, Mexican, Syrian, Filipino. And for most of our families, they don't really go to the doctor unless they really need to. Noe's family says that, or they believe that doctors are out to get your money, or a lot of us also mostly want to treat symptoms. But Ariana's parents are both nurses, so they're very okay, let's get some medicine, stuff like that. For home remedies, Sandra's family is very much about home remedies. She says that they do egg whites on top of burns, alcohol plus cotton for stomach aches, and whiskey, black tea, and honey if you have a cough. For Maddie and Noe, there's cupping and aloe vera for burns, Vicks, and Mexican medicine. And
what's Mexican medicine?
Mexican medication, he didn't clarify.
Using a Spanish.
Yeah. Tell us, say it. The witch doctors.
What is it?
Magician.
Mexican magician. So what was it?
It's just I don't know. I don't even know what he is. It's just some guy that they go to. It's kind of a second opinion.
Okay.
But all he does is kind of massage them, and then they walk out and they're like, oh yeah, I'm cured.
So it's here.
Yeah.
Okay.
And then for my family, Filipinos are really big on Vicks and the hot water plus salt if you have a sore throat. And yeah, so for the concerns or seeking medical attention in general, our families are not very preventative. They like to wait till the last minute, and yes, home remedies first.
Okay, good. So I hope this was kind of a fun thing for you today, just kind of let down. This will be my last seminar with you for this year, I believe, because next week Miss Lennon is speaking about your anesthesia test, and I don't know if she's going to use the whole time. If not, I'm going to address these issues from this. But I briefly went through and looked at it. A number of people are concerned about competencies, about not getting them, and why we're grading so heavily on those. rather than our clinical skills. That's what they said. And I'm thinking, that is your clinical skills. Part of your clinical skills is not just scaling somebody's teeth. It's about your EOIO, it's about oral hygiene, it's about radiology. You are a clinician, you are not a teeth cleaner. Okay, so that's why we're weighing that. What's going to happen if you don't get them all is that percentage of your grade, I believe it's 30%, you'll be missing one of the 30%. So if you miss one competency, you're not going to fail clinic. So don't get that in your head. That is one 30%. So if that's 30% of your grade, and let's say we need 12 competencies, just say, and you have 11, you're going to be 1/11 of 30% of your grade. You are not going to fail. Okay? So relax on that. The second thing is, a lot of people mention, I wish clinic was, straight through on a Wednesday. I have no control over that. I can't change that. That was a Dr. Richards thing. Write it on your review, okay? Because what Dr. Richard wanted, she got. And we all had to change because of that. That is not my choice as the clinic director. I would have not said, because I know your head is not focused in here when you're worried about there, or you're not focused there when you're trying to get through oral path. So I understand that totally. I would totally vote to change that if I could. And maybe we could do it next year. I don't know if we get enough people complaining, and when you go and meet with the admin, your president and all that.
with them today.
Complain about it till no end. It's messing up our clinic. Even the faculty don't like it because we're cutting corners to try to get you to do more on the clinic too. And I don't like it. I don't like when they're saying, oh, do this, because this is the protocol we want you to do. And then when you're not doing that, then you get another instructor. Well, your last instructor did this. It was causing us to not be calibrated. Patients are upset. Yeah,
Actually,
you
they
gotta
come back
say
for like
that.
20 minutes just to finish.
Yeah, another thing that I saw on some of these is anesthesia. That's another thing that got brought up. They don't feel like they're ready for anesthesia. I offered the very first day of school to come, let's practice. Not one has taken me up on that. I'm not saying you maybe have taken other people up on it, but you have that test in a week. 2 weeks. 2 weeks. So practice. Go hit up your faculty. Do it. I see a lot of you hitting outside, getting other competencies. You don't need 5 FMX evals. Go practice your anesthesia. It's not benefiting you at all. It's helping you to get the other thing, but it's not helping you here. So work on some of those. If you don't have a patient, get with a buddy and practice your anesthesia. We're willing to help you. As far as faculty, we have more faculty on clinics than we have had in the last 5 years. So other people are saying we need more faculty. I think we have enough. It's just that moving through the process. Some of the things that you guys can do to make it faster, and that is at the end of the day, mark all your things so I don't have to change all your your P's to C's. Do things that will help me move faster from my chair to your chair to your chair. Okay? But I will look more in detail at this, and if Miss Lennon doesn't need the whole time for the anesthesia, I will take like 10 or 15 minutes to go over that. There will be no quiz over this. I hope it was just fun for you and gave you a little bit of idea of what a patient is feeling, maybe what your change in your dental oral health care changed from when you walked in the door to what you believe now, what you know now. So it's just an eye-opener to healthcare and different cultures. So anyways, the following week after next week's lecture by Miss Lennon is a holiday, so we don't have class. And the week after that, I've opted not to give you a final exam so that you can study for your own finals. So that's why I say there's no more class with me unless Miss Lennon gives me time next week. So good luck with your finals. If you have concerns about clinic other than what you put on the paper, my door is always open. I know a number of you have already come and just cry their eyeballs out. Some of you have major concerns with other things. Other people had other issues. Stop by. I'm willing to do that for you. All right? Have a good day.
I do want to take you up on the station. I know I did.
When do you want to do it?
Only on Fridays.
What did I mean? So that's
I have other days. What do you have Monday afternoon? It's a full day. I'm in office all Monday afternoon.
And most likely, I know you don't want to stay.
Well, we can. Why? Because we have to have it here.
Not just you?
No, we have to have it in because that's one of our
Okay.
so that's why.
And I know you specialize, I guess, in the
Small hands.
Small hands, yes.
Yes.
So that. And then Friday. Let's see. I'll gather